In our first question for the evening, 43 million Americans do not have health care. In Minnesota, almost 500,000 are uninsured. As a state legislator, what would you do to extend affordable health care to every Minnesotan?
I talked about this at our forum on Tuesday night, but I think one of the best solutions that I've heard recently is the Minnesota Health Plan introduced by Senator Marty last session. And if we back up for just a second, the realism of what is going on is that we have huge chunks of people that aren't covered. That's indicated in the question. But when we dig underneath and we ask, well, why are there people that don't have coverage? And we end up on the insurance side of the issue. It's not about providers. It's not about the services not being there. It's about the fact that people either can't afford independently or don't have access to methods to get the money to have their coverage. And so, actually, through this process and getting some education, I've decided that I think the answer lies on the insurance side of the question. And getting everybody through a government program, you can call it socialized insurance, I don't care, but the fact is that we have to get everybody back into the same pool. When you look at what is going on in healthcare, and right now you have people that are self-employed, people that are part-time. Myself, I use this example every time we talk about this question. I teach part-time at 2 different college campuses here in town, which means I'm not enough at either one to qualify for benefits. I have my own health care coverage. I purchase it completely on my own. It's not great, but it's something. But I'm also somebody who has relatively few health issues, and I'm not in the pool with everybody else who has more significant health issues. So you keep pulling those people out, and you continue to be left with people that have more and more serious issues, more and more costly, more and more difficult to deal with. So the plan that Senator Marty put out last year, the Minnesota Health Plan, that deals with the insurance side of the equation, I think is the right way to go. I would support it, and I think Minnesota needs to lead and not wait for the federal government to take action.
In regard to affordable health care, I do agree with Roger in some ways. You really have to start looking at where we are as far as the insurance companies. Every year, the Minneapolis Star-Tribune puts out an article that basically lists the top 100 CEOs in the state of Minnesota. Quite often, if you look at that list, 4 of the top 5 are from insurance companies, health insurance companies. Now, first of all, you really have to question the top 5. 4 of the top 5 highest people in the state are getting whose money? Dr. Marilyn down at the other end knows firsthand, as a doctor, that a lot of those reimbursements aren't necessarily coming to them. The accessibility isn't necessarily to his clients and to his patients. I, for one, know this firsthand. I think that the legislature needs to look at, first of all, how the money is being spent. That's the first thing. Where is this money being spent? Is it going to the insurance companies? Is it going to the doctors? Where is it going? Is it going to the pharmaceutical companies? That's what we have to look at first. And once we figure out where this money is going, because we know that it's a gazillion-dollar industry, but we know that the people that truly need to be served aren't. So I think, first of all, what the legislature has to do is really take a very close look from the healthcare system, both private and public, and figure out where the shortfalls are, where the gaps are, and be honest in recognizing who's being served and who's not.
I deal with this each and every day in my work life, representing workers. A couple of years ago, I wrote a story in one of our alternative weekly papers about a member of ours who works in an adjoining county, who works 60 hours every 2 weeks. And she called me and said, "I'd like to show you my pay stub." I went up and took a picture of it. After she paid for her health insurance, she took home $3.06. There was a time in this country when we were able to ignore the health insurance crisis because it just applied to poor people. It was sad that we ignored it then. It is eating its way into the middle class very quickly. We couldn't afford to ignore it then. We can't afford to ignore it now. We are already spending the money on health care, way more than we would be spending if we had a system of universal coverage. I support John Marty's plan down in the legislature. I think we have to get moving. Minnesota ought to be a leader in this area. We can be. We need to take giant steps, not baby steps.
Here we get to that different thing about me. I don't agree with most of the candidates up here. I think that healthcare is a huge problem. I think it's a huge problem facing our entire country, and until we change these systemic problems that are facing the country, it's going to be really difficult to fix the problem in Minnesota in a financially responsible way. I know some of the candidates up here like to look at the Massachusetts plan. The Massachusetts plan's been going on for a while, and the one problem that plagues national healthcare systems is running rampant in the Massachusetts plan, and that is administrative costs. In the United States today, about 15% of our total healthcare costs are spent on administrative costs. And if you look across the world, nations have identified this as a killer of national healthcare problems. This is one of the critiques of federal subsidized programs, the administrative costs. So if we can implement a plan in the state of Minnesota that has administrative costs at around 5%, that of Taiwan, who has an excellent healthcare system, I would support that. I haven't seen a program that really highlights this problem. So as far as it goes, I look at it right now as something we can do. We can slow down the bleeding. You know, we can get those 20,000, those more than 20,000 people who right now they're eligible for the Minnesota Health Program, and they're not signed up. We can get those people signed up. We can work with Tim Pawlenty to try to get some more funding for this. But I mean, as far as trying to fix the problem in the state, I see it as too big of a problem to fix in our state. I'm sorry.
Thank you. Well, the Clintons tried to get a universal health care, one-payer system in the federal government, but they failed to have any of the health professionals helping them make decisions. End result, it failed. And Minnesota is just one of 50 states, and in our country and culture have many problems, which we all are aware of. However, keeping Medicare viable and effective is our largest long-term public policy challenge today, because the cost is exponentially rising geometrically, and our country cannot afford it. As my partner here said, 15% goes into administration. He's very generous because it's really 40%. And in February this year, the Minnesota built a reformed healthcare caucus, and Mr. Marty was one of the instigators, and he has the right idea and going in the right direction. Now, the nice thing about healthcare is that we already have the system. Medicare takes care of our elderly. That's already there. We have Minnesota Care that is already in effect. We have medical assistance that's already in effect. But there's many millions of people that are young working people that do not have health care. And that's where we have to get some kind of a state plan where everybody has a basic, easy access to health care that can afford, and they can afford in their budget. Like 5% is a good number, maybe 6%. The purpose of this is that these people will come in to see their physician when they have minor problems instead of waiting till they have major problems, because major problems cost about 100 to 200 times more than minor problems. In other words, I'm saying let's put out the campfires and not have forest fires. And that's my position to try to get health care in Minnesota.